Welcome back, and I'm glad to know you're taking an interest in learning more about your hearing health. Lecture 1 in this series discussed the complexities of the hearing system and the importance of a complete hearing exam when hearing loss is suspected. Lecture 2 discussed treatment options and what to expect with hearing aids. In this third installment, we'll discuss disease processes associated with hearing loss. On the list in front of you, malnutrition can be directly linked as a cause of hearing loss. Diabetes and chronic kidney disease do not necessarily cause hearing loss, but we know whatever causes someone to develop these two issues, they are more likely to also develop a hearing loss. The others on this list, isolation, depression, loss of memory skills, and dementia, all have untreated hearing loss as one of their causative agents. While it's not the only thing that causes these problems, hearing loss can be treated and removed as a cause. Now, fortunately for most of us in the United States, severe malnutrition is not a problem, and therefore we see relatively small numbers of nutrition-related hearing loss. But there are those of us who may have other health complications that contribute to poor overall nutrition. For those that are concerned, folate is the essential mineral associated with good hearing health. Also, antioxidants like vitamin C are shown to help prevent hearing loss, and in some very small studies, high doses of vitamin C are being used to treat hearing loss in an attempt to reverse damage done in the nerve endings. To date, these studies are inconclusive. The relationship now between diabetes and hearing loss is getting more and more attention, especially with the growing numbers of diabetics that we have in our population. By collecting data on a huge population sample over a 5-year period of time, we have some pretty impressive figures regarding the relationship between diabetes and hearing loss. Diabetics are twice as likely to develop hearing loss as non-diabetics, and even pre-diabetics are 30% more likely to develop hearing loss. If you have any control to prevent yourself from getting diabetes or need another reason to keep your current diabetic situation under control, you can now add hearing loss to the list. While many scientists have speculated the link between hearing loss and diabetes since the 60s, we're now able to see with better imaging technology that the same degenerative effects that occur in the kidney can also be seen in the cochlea. Remember, the cochlea is where the hearing nerve is housed. One of the more striking developments that has surfaced lately is the correlation of early onset dementia and untreated hearing loss. These studies did not originate from scientists specifically studying hearing loss, but rather researchers interested in finding ways to prevent dementia. We know that once dementia sets in, it's very difficult to impossible to treat. So why not find out how to prevent it in the first place? Like the diabetes study, this was a large study population where data was collected over an 18-year period of time. The long time allowed for the normal aging process to occur in the patient population. And at the end of the study, researchers determined that 30% of the risk associated with the onset of dementia was associated with untreated hearing loss. And that risk tended to increase the more the severe the hearing loss became. At this point, we need to consider this. If it's easier to prevent dementia than treat dementia, we should consider all preventative techniques. If we could remove 30% of our risk of acquiring dementia by treating hearing loss, would getting hearing help make more sense? We also need to consider the importance of a quality and balanced diet. We know nutrition plays a direct role on our hearing health, and we know that a good diet is important to prevent the onset of diabetes and chronic kidney disease, which both show correlations to increased risk of hearing loss. Well, that concludes our three-part series on hearing health. If you've watched all three slideshows and you still have questions regarding your hearing health, you still have options. Call us today at 1-877-304-9099 to book a private hearing evaluation where you can find out more details about your specific hearing loss. If you're not ready for an exam and you want to hear this lecture series presented in more detail, call the same number to find out when our next monthly class will be held. The class is free and is available to your family as well. So call today and reserve your spot at our next seminar. See you there.